Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Welcome to the deep dive. Today, we are putting on our protective eyewear, or maybe we should be asking why more people aren't, as we serve up the deep look into the fastest growing sport in America, pickleball.
It really is everywhere now.
Absolutely. If you're one of the, millions of players now, you totally get the appeal. It's easy to pick up, the rules aren't complicated, and it's got this great reputation for being, low impact.
And that reputation isn't just hype. The numbers are, frankly, phenomenal. By 2024, we're talking nearly 20 million players just in the U.S.
20 million.
Yeah, and think about how fast that happened. There was a 44% jump in players just from 2023 to 2024.
44% in 1 year.
In 1 year. And if you look back to 2020, it's a massive 311% increase. It's really exploded across all age groups, all kinds of athletic background.
But that explosion, that massive boom, well, it has a hidden side, a pretty expensive one, actually. And that's what we need to get into today.
Right. Because while the game feels maybe gentler on the knees or the back compared to, say, tennis, the speed and how close players stand has created this unexpected public health cost.
You're talking about injuries.
Big time. The estimated healthcare costs for all pickleball injuries, not just eyes, but ankles, shoulders, everything, they were projected somewhere between $250 million and $500 million.
$500 million. For 2023 alone.
Potentially, yes.
Yeah.
For a sport known for being low impact, it's a lot.
It really forces you to rethink that general label, doesn't it?
It does, and it pivots the conversation. We've always known about injuries in racket sports, tennis elbow, squash eye injuries, badminton falls.
Sure, those are documented.
But the sheer scale and the specific types of injuries happening in pickleball, particularly eye injuries, hadn't really been measured scientifically until very recently.
Because it grew so fast.
Exactly. The sport just outpaced the research, essentially. The injury data is playing catch-up to the number of people on the courts.
Okay, so that's our mission for this deep dive then. We need to catch up. We're looking closely at a really important study that came out in JAMA Ophthalmology.
That's the Journal of the American Medical Association's eye publication, a major one.
Right. And it was led by researchers at Rutgers, New Jersey Medical School. They specifically dug into the ocular trauma, the eye injuries linked to pickleball.
So we're going to break down their findings, look at this accelerating trend they uncovered.
We'll identify who's most at risk, why this plastic ball is actually causing such serious damage.
And then there's the whole debate about protective gear, right? The policy side of things.
Absolutely. We need to explore that. Should eyewear be mandatory? What's the holdup? We want to give you the insights you need to play safely.
All right, let's get into the data itself. Because to really understand the problem, you have to see how quickly it escalated.
This wasn't a slow burn.
Not at all. The researchers looked at records covering a long period from 2005 right up to early 2024, so almost 2 decades.
And what was the total number they estimated over that time?
The national estimate landed at 3,112 eye injuries linked specifically to pickleball.
Okay, over roughly 20 years. 3,100 doesn't immediately sound like a pandemic.
But here's the kicker. That number is incredibly misleading if you think it was spread out evenly.
How so?
The vast majority, a really striking 88% of those 3,112 injuries, happened just between 2022 and 2024.
Wait, 88% in just the last 2 or 3 years of a 20-year study period?
Exactly. It's not a curve, it's like a hockey stick graph. It took nearly 17 years to get the first, 12% of the injuries? And then the remaining 88% piled up in just 24 months or so. It's exponential growth in risk.
That changes the picture completely. It's not a long-term, low-level issue. It's a sudden, sharp spike.
A very sharp spike. And look at the estimate for just the last year they included, 2024. They projected 12,262 eye injuries for that year alone.
1,262. That's nearly half the entire 20-year total happened in just 1 year.
Pretty much. It shows the problem isn't just growing, it's accelerating dramatically. Faster than courts are being built, like you said earlier.
So the statistics back this up firmly.
Oh, yeah. They did what's called a survey-weighted linear regression. Basically, a way to look for trends across the whole population using the sample data. They focused just on those recent years, 2021 to 2024.
And what did that analysis show?
It showed that the estimated number of pickleball eye injuries is going up by 405 new cases every single year during that period.
An increase of 405 injuries per year. That's the rate of acceleration.
That's the rate of acceleration. And the study authors themselves use the term alarming rate. And you can see why.
An alarming rate indeed. That has huge implications for emergency rooms, for eye doctors.
Absolutely. When you see numbers like that and an acceleration like that, it starts to rival or even potentially surpass injury rates in sports we think of as much more dangerous. If this 405 per year increase continues, pickleball could very quickly become a leading cause of sports-related eye trauma in the country.
So it shifts from just advising players to maybe wear glasses to potentially straining ophthalmology resources?
That's the concern. Eye specialists are already stretched thin in many areas. An extra 400, potentially soon 800, then 1,200 serious eye injuries per year. That's a real public health burden. That's the consequence of that acceleration rate.
Okay, before we get into the specifics of who is getting hurt and how bad the injuries are, let's just quickly cover how the researchers actually did this. How did they get these numbers?
Right, the methodology is key to trusting the results. This study, by Corey Lacher and his team, was what we call cross-sectional, retrospective, observational.
Meaning they looked back at existing data?
Exactly. They weren't running a new experiment. They were analyzing historical records to find patterns linked to pickleball. Detectives, essentially.
And their main tool wasn't just asking a few eye clinics. They tapped into a big government database, right?
Correct. They used the U.S. Consumer Product Safety Commission's National Electronic Injury Surveillance System. Let's just call it the National Injury Tracker.
Yeah.
It's a really powerful system. It collects coded data on injuries related to consumer products, and sports fall under that from about 100 hospital emergency departments across the country.
Why only 100 hospitals? Doesn't sound like that many.
But these aren't just any 100 hospitals. They're a scientifically selected probability sample. They represent about 2% of all U.S. emergency departments, but because of how they're chosen.
They can represent the whole country.
Precisely. The data from these 100 EDs can be statistically weighted and extrapolated to generate reliable national estimates. It gives the study huge scope. They looked at cases logged in this system from 2005 through early 2024.
Got it. So how did they find the pickleball injuries within potentially millions of emergency room visits over 20 years? That sounds like finding needles in haystacks.
It requires careful searching. They didn't just use a generic sports injury code. They actually search the narrative text fields.
The notes the doctors or nurses wrote.
Exactly. They search those descriptions for the specific word pickleball and even common misspellings or related terms. That initial search pulled up around 2,500 total pickleball injuries, all body parts.
Okay, so nearly 2,500 injuries overall. Then they had to narrow it down to just the eyes.
Yes. They then filtered those cases using specific body part codes for face and eye. That careful filtering left them with 73 actual unweighted cases of eye injuries linked to pickleball within those 100 hospitals.
73 cases. And those 73, when weighted,
when statistically weighted based on the hospital's size and representativeness, generated that national estimate of 3,112 eye injuries we talked about.
Okay, that makes sense. It shows the rigor behind the number. And they didn't just count injuries, they collected details about each case.
Oh yeah, crucial details. Age, sex, the year the injury happened, which let them track that acceleration, whether it was the right or left eye. Importantly, the mechanism in it, like was it the ball, a fall, the paddle? And critically, the specific type of eye injury diagnosed, corneal abrasion, retinal detachment, etc.
All that detail lets you paint a much clearer picture of who's getting hurt and how badly.
Exactly. It helps pinpoint the real risk factors.
All right, let's dive into that picture then. Who is most at risk according to this data? Does it match the sort of stereotypical image of a pickleball player?
It largely does, at least for the eye injuries. The data clearly shows older adults are the most vulnerable group here. The average age of the injured patients was about 54 years old.
54 average.
And the median age, the exact middle point, was 58.
58. And how dominant was that older group in the injury stats?
Very dominant. Here's the key finding. 70%, 70 of all the estimated eye injuries happened in players aged 50 or older. That's about 2,168 cases out of the 3,112 total.
70% over 50. Why is that group so much more vulnerable? Is it just slower reflexes?
It's likely a combination of factors. Yes, reaction time naturally tends to decrease a bit with age, but it's also potentially linked to changes in balance, maybe muscle mass, overall physical conditioning.
And balance seems key because you mentioned falls earlier.
Right. We'll get into the mechanisms more later, but falls were a major cause of injury, and the average age for those injured in a fall was even higher, 68 years old.
Wow. Okay, but here's something that seems a bit contradictory. If 70% of the eye injuries are in the 50-plus group, how does that square with the fact that the average age of all pickleball players is apparently dropping?
That's a really important point the study acknowledges.
Yeah, they noted the average player age is now down around 35, and the biggest group playing is actually 25 to 34-year-olds.
Correct. About 2.3 million participants in that bracket alone. So you've got this huge cohort of younger players flooding the courts.
So why aren't they showing up in the eye injury stats as much yet? Are they just better players or luckier?
It could be several things. Younger players likely do have faster reaction times, maybe better conditioning on average. They might be playing a faster, more aggressive game, which paradoxically could mean they're more exposed to high-speed hits, but perhaps better able to defend against them currently.
So the risk is there for them too. It just hasn't translated into the same injury statistics yet.
Exactly. It might be a lagging indicator. As this younger, larger group plays more often, gets more exposure over time, we might see that demographic shift in the injury data in the coming years. It's definitely something to watch.
What about gender? Any difference in risk between men and women?
Interestingly, no significant difference found there. The estimates were pretty close, 56% male, 44% female. Seems like once you're on the court, the risk is pretty equal regardless of gender.
Okay. Now, the really critical part, the severity. When someone does get hit in the eye, what kind of damage are we talking about? Is it usually just a black eye?
Unfortunately, it's often much worse than a simple bruise. The injuries basically fall into two camps. The more common ones, thankfully, are less severe but still need medical attention.
Like what?
Things like periocular lacerations, cuts around the eye socket, that was about 35% of cases. Then corneal abrasions, scratches on the surface of the eye itself, that was 16%.
Still sounds painful.
Oh, definitely. And things like arteritis, which is inflammation inside the eye, that was 8%. Subconjunctival hemorrhage, basically bleeding on the white part of the eye, 5%. Bruising around the eye, 5%. These all need checking out to prevent infection or scarring.
Okay, so those are the more frequent, less severe types. But the study also found evidence of really serious, potentially blinding injuries.
Yes. And this is where the true danger lies, and probably where a lot of that huge healthcare cost estimate comes from. Even though these severe injuries make up smaller percentages of the total, they are devastating.
What kind of injuries are in the severe category?
We're talking about hyphema that's bleeding inside the front part of the eye, between the cornea and the iris. That accounted for 5% of injuries.
Bleeding inside the eyeball.
Yes. Then retinal detachment, where the light-sensitive tissue at the back of the eye pulls away, that was 3%. Globe trauma, essentially blunt force injury causing damage to the eyeball structure itself, also 3%.
3% might sound small, but out of thousands of injuries.
It adds up to dozens and dozens of people facing potential permanent vision loss. And finally, orbital fractures, broken bones in the eye socket, that was 2%.
Broken bones around the eye from a plastic ball.
It can happen, yes. The force can be significant.
Explain why something like a retinal detachment is so serious. What does that actually mean for someone's vision?
A retinal detachment is a true ophthalmic emergency. If that tissue detaches and isn't surgically reattached very quickly, sometimes within hours or days, the photoreceptor cells die off. Meaning permanent, irreversible blindness or severe vision loss in that area of the eye. There's often no getting that vision back once it's lost.
And the hyphema, the bleeding inside, what's the danger there?
The blood pooling inside the eye can clog the eye's natural drainage system, causing the internal pressure to skyrocket. This is called secondary glaucoma, and that high pressure can crush the optic nerve, again leading to permanent vision loss if not treated aggressively.
So we're way beyond just a temporary black eye here. These are potentially life-changing injuries requiring urgent, complex medical or surgical intervention.
Absolutely. And these aren't just theoretical risks pulled from the database codes. The researchers pointed to other case studies that have documented these severe outcomes specifically from pickleball.
Like what?
Things like traumatic lens subluxation, where the eye's natural lens is knocked out of place and needs surgical replacement. Documented retinal tears, sometimes with bleeding into the vitreous jelly inside the eye. Cases of that high-pressure hyphema we just discussed.
So that 3% for retinal detachment isn't just a statistic. It represents real people potentially losing their sight from a sport they thought was safe.
That's the stark reality this data highlights.
Okay, let's dig into how this happens. The mechanisms. You mentioned the ball, falls, and paddles.
Right. The study broke down the causes based on the emergency department narratives. The most common culprit, maybe unsurprisingly, was a direct hit by the pickleball itself. That accounted for 43% of the eye injuries.
Nearly half. What was second?
Falls. That accounted for 28%. And as we noted, that was heavily skewed towards older players, with that average age of 68 for fall-related injuries. This really points towards balance, agility, and maybe even footwear being key factors for that group.
And the least common cause.
A direct hit by a paddle. That was only 12%. But interestingly, the average age for a paddle-related eye injury was much younger, about 30 years old, maybe reflecting more aggressive play or closer positioning during fast exchanges. Hard to say for sure.
Let's focus on the ball impact, since it's the biggest cause.
Yeah.
This ball. It's plastic, it has holes, it feels light. Why is it causing orbital fractures and retinal detachments? It doesn't seem intuitive.
It comes down to physics and biology. Specific biomechanical studies have looked at what happens when a pickleball hits an eye model. They found a critical speed threshold. If a pickleball is traveling faster than about 82 kilometers per hour, that's roughly 51 miles per hour. It carries enough force to significantly deform the eye's structures upon impact. We're talking about the cornea getting pushed in, the vitreous jelly inside getting compressed, and the retina at the back getting distorted.
And that deformation causes the damage.
It can directly lead to things like the lens being knocked loose, or the retina tearing or detaching from the stress. It overcomes the eye's natural protective mechanisms.
But does pickleball really get played at speeds over 50 miles an hour? It often looks much slower, more about dinks and placement.
Oh, it absolutely does, especially now. That's where the evolution of the equipment comes in. The game is much faster than it used to be.
Because of the paddles?
Largely, yes.
Yeah.
Modern paddles use materials like graphite, carbon fiber, and specialized foam cores like ethylene vinyl acetate foam, specifically designed to maximize power and ball speed off the paddle face.
So players can hit it harder now.
Much harder. Skilled players, especially in doubles exchanges or drives, can generate ball exit velocities that approach and maybe even exceed 96 kilometers per hour.
96 kph. That's about 60 miles per hour.
Exactly. Well above that 51 mile per hour threshold for potential serious eye damage.
Okay, 60 miles per hour is definitely fast enough to cause trauma. But you mentioned proximity earlier. That's the other crucial factor here, isn't it?
It's the lethal combination. Speed plus proximity. Pickleball is unique in how close opponents often stand.
You mean at the kitchen line?
Right, the non-volley zone line. Players stand just 4.2 meters apart there. That's only 14 feet.
14 feet. That's really close for a 60 mile per hour projectile.
Incredibly close. Yeah. Think about the reaction time. If a ball is traveling at 60 miles per hour over a distance of only 14 feet.
How much time does that give you?
Calculations show it gives you about 0.16 seconds.
0.16 seconds. Less than a fifth of a second.
Yes, less than a fifth of a second to see the ball coming. Process the threat is aimed at your head and initiate a defensive move, flinch, turn away, get a paddle up.
That's barely humanly possible, even for a pro athlete. It's extremely challenging. And remember, the average age of the injured player in this study was 58. That reaction time deficit, combined with ball speeds exceeding the known damage threshold at incredibly close range, that's the recipe for these severe eye injuries.
It really paints a picture of why the risk is so high at the net. This connects back to something the researchers suggested, didn't it? About who might be driving the recent surge in injuries.
Yes, they proposed what you could call the casual player hypothesis.
Meaning?
They suggested that the massive growth in the sport has brought a huge influx of newer, more casual players onto the courts, maybe people playing fewer than, say, 8 times a year.
And these casual players are at higher risk?
Potentially, yes. They might be less familiar with the pace of the modern game, maybe less aware of the dangers of standing close to the net during fast exchanges, or perhaps just have less developed defensive reflexes or muscle memory compared to more seasoned players. So the surge in new, maybe less experienced players getting hit by high-speed balls they weren't expecting could be a major factor behind that alarming 405 new cases per year increase.
That's the theory the researchers put forward, and it makes a lot of sense, given the confluence of booming participation and increasing game speed.
Okay, we've seen the alarming trend and the potential reasons why. But like any study, especially one using a large database, there are limitations to consider, right? We need to critically assess this data.
Absolutely. And the journal actually published an invited commentary alongside the Rutgers study written by other experts specifically to address these points. It's crucial for context.
What did the commentary highlight? Did it praise the study's approach first?
it did acknowledge the value.
Yeah.
Using big population databases like the National Injury Tracker is powerful. You get scale, scope, results you can generalize to the whole country. That's vital for public health policy, which was the goal here.
But then came the caveats. What were the main concerns about the data source itself?
One key point was about the stability of the estimates, particularly for subgroups. Remember that the national estimate of 3,112 injuries was based on 73 actual cases found in the sampled hospitals.
Right, 73 unweighted cases.
The CPSC, which runs the database, generally considers estimates potentially unstable or less reliable if the raw number of cases used to generate them is less than 20.
So while 73 is well above 20 for the overall estimate.
Exactly. The overall trend estimate is likely quite robust. But when the researchers tried to break down those 73 cases into smaller groups, say, looking only at orbital fractures or only at players under 30, or only at injuries caused by paddles, the number of actual cases in those specific subgroups often dropped below 20.
So the detailed breakdowns, like saying exactly 2% suffered orbital fractures, might be less reliable than the main finding of a steep overall increase.
That's the statistical caution. The overall signal is strong, but some of the finer details within that signal might have wider margins of error because they're based on very small raw numbers.
Okay, that's important nuance. What was the other major limitation they pointed out? Something about who gets counted.
This is probably the biggest one. The database only captures injuries treated in hospital emergency departments.
Only ED visits. It misses everyone else.
Completely. It misses every single person who had a pickleball eye injury, but went directly to their eye doctor or an urgent care clinic, or just managed it at home initially before seeing a specialist.
And what does that mean for the overall estimate of 3,112 injuries?
It means that number is almost certainly a significant underestimation of the true total number of pickleball eye injuries happening nationwide.
Because lots of injuries, maybe the less severe ones, wouldn't end up in the ER.
Precisely. Think about a simple corneal abrasion. Painful, needs treatment, but many people might call their optometrist or ophthalmologist directly rather than sit in an emergency room for hours. Those cases are completely invisible to this database.
So the real number could be much higher. And does this exclusion also skew the types of injuries reported?
Yes, it creates a bias towards severity. Because the system predominantly captures people seeking emergency care, the data is likely overrepresenting the most dramatic, acute, and vision-threatening injuries. The detachments, the severe bleeds, the fractures. The true distribution might include a much larger base of milder injuries that aren't reflected here.
So the alarming data we have is likely only the tip of the iceberg, and the most severe tip at that.
That seems to be the strong implication. Plus, there are always potential data quality issues with databases relying on manual entry and coding. Notes might be incomplete, codes might be misapplied. And interestingly, the commentary noted that the narrative text fields used to search for pickleball were generally shorter and less detailed before 2019. So it's possible some older cases were missed simply because the description wasn't specific enough, further contributing to that underestimation bias.
Okay. And one final limitation this data tells us about the injury event, but not the long-term consequences, right?
Correct. Being observational and retrospective, it can't track patients over time. We don't know the final visual outcomes for these 3,112 estimated injuries. We don't know the true long-term financial cost beyond the initial ER visit.
And those long-term costs can be substantial.
Hugely substantial.
Yeah.
The commentary cited another study looking at orbital fractures, just one type of injury found here, and the average follow-up cost over just 3 months was around $7,100 per patient.
$7,000 for follow-up on just one injury type.
Yeah. Now imagine the lifetime costs of managing secondary glaucoma from a hyphema, or visual rehabilitation after retinal surgery, or lost productivity due to vision impairment. That initial $500 million estimate for all pickleball injuries starts to seem potentially quite conservative when you factor in these long-term burdens.
Okay, so even with those limitations, the underestimation, the severity bias, the core finding of a rapid, accelerating increase in serious eye injuries holds. That brings us squarely to the policy question. What's being done?
Well, that's the concerning part. Right now, there's a major policy gap, meaning there's currently no mandate for protective eyewear in pickleball. Not for casual play, not even for professional tournaments.
Zero requirement, despite this data.
Zero official requirement from the main governing body. And this isn't because they're unaware. There was a specific push to change this recently.
What happened?
USA Pickleball, which sets the official rules, considered a rule change proposal back in March 2024 that would have mandated protective eyewear, at least for sanctioned tournaments.
And they voted it down?
They disapproved it. The main reason they cited was the perceived difficulty of enforcement. How would they ensure compliance across countless courts and players nationwide?
So logistical challenges trumped the safety data, essentially.
That seems to be the outcome.
Yeah.
And because the national body doesn't require it, most local clubs, public parks, rec centers, they don't require it either. It creates a culture where playing without eye protection is the norm.
Okay, so if the governing body isn't mandating it, what are the researchers who did the study and major health organizations recommending?
Their primary recommendation is crystal clear. We need standardized guidelines for eye protection in pickleball to prevent these potentially blinding injuries. It needs to become standard practice.
And are there specific standards they recommend? Like what kind of glasses should people be looking for?
Yes. The American Academy of Ophthalmology, the leading body of eye surgeons, points to the ASTM F3164 standard.
ASTM F3164. Oh, what does that actually mean in practical terms for someone buying eye protection?
It means the eyewear has been tested specifically for racket sports impact. The key things you're looking for are lenses made of polycarbonate.
Polycarbonate, not regular plastic or glass.
Absolutely not regular plastic or glass.
Yeah.
Polycarbonate is incredibly impact resistant. It's designed to withstand a high-speed hit from a ball like a pickleball or racquetball without shattering. Standard eyeglasses or sunglasses can actually increase the injury risk because they can shatter on impact, sending shards into the eye.
Okay, so polycarbonate lenses. What else does that ASTM standard cover?
It also covers the frame design. The frame needs to be robust enough to hold the lens securely during impact and designed to deflect force away from the eye socket, preventing the lens itself from being pushed back into the eye. This standard is already used for sports like squash and racquetball, and it works.
And we know prevention like this is effective because we've seen it in those other sports, right? Pickleball injuries are soaring, but tennis and baseball have seen declines.
Exactly. The data for tennis showed a decrease in eye injuries over the past couple of decades, settling around maybe 450 per year recently. Baseball eye injuries also dropped significantly, down to around 200 per year.
Likely due to helmets with face shields, awareness campaigns.
And protective eyewear becoming more common. It shows that proactive measures work. And the example of squash is maybe the most direct comparison.
Why squash?
Because it's also a high-speed, close-proximity racket sport. Studies there found that when players were actively educated about the benefits of protective eyewear, they were almost 2.5 times more likely to actually wear it.
So education and promotion, maybe even alongside a mandate, can really shift behavior.
Definitely. It changes the culture around safety. Pickleball just hasn't reached that point yet in its policy or widespread player habits.
And finally, going back to the most vulnerable group players over 50, who suffer 70% of the eye injuries and also have that high rate of falls. Are there specific things they should be focusing on beyond just eyewear?
Yes. For that group, prevention needs to be broader. Eyewear meeting that ASTM standard is absolutely critical, especially if they have existing eye conditions like high nearsightedness or family history of retinal problems.
Non-negotiable eyewear. What else?
Addressing the fall risk is key. That means incorporating specific balance training exercises into their routine. Also, strength training to maintain leg and core strength and regular stretching for flexibility.
And footwear, you mentioned that earlier.
Crucial. Wearing proper court shoes designed for lateral movement and grip on a hard surface, rather than just standard running shoes, can make a big difference in preventing those slips and falls that account for nearly 30% of the injuries.
Okay, let's try to bring this all together then. What's the main takeaway from this deep dive?
I think the core message is that pickleball, despite its fantastic accessibility and fun factor, has rapidly developed a serious quantified public health risk attached to it.
A risk that was maybe hidden by its low-impact image.
Exactly. This study, using national data, puts numbers on that risk. It shows a sharp, undeniable, accelerating increase in severe eye injuries, 405 more each year recently.
And while older players are currently the most affected group, the underlying cause, the physics of a fastball in close quarters, poses a risk to everyone on the court.
Absolutely. The modern equipment generates speeds well above the threshold known to cause serious ocular trauma, and the close net play leaves minimal reaction time.
So we have this clear data, but a policy vacuum.
That's the dilemma. The evidence points strongly towards needing protective eyewear mandates, similar to other racket sports. But the governing body has hesitated, citing enforcement challenges.
Which leaves the responsibility largely on the individual player right now.
It does. And the question for you, the listener playing pickleball, isn't really if you should consider eye protection anymore. The data says the risk is real and growing. The question is, why wouldn't you take that simple step?
Knowing that ball can hit 60 miles per hour, knowing it can deform your eye, knowing polycarbonate lenses meeting the ASTM standard can prevent that. It seems like a straightforward choice.
It really should be. This research is a tool. It quantifies the danger that may be felt anecdotal before. It should inform individual choices, club policies, and hopefully national governing body decisions soon.
So the final thought for everyone listening. We've laid out the data, the physics, the risks. Until mandates are in place, protecting your vision is up to you. Put on the proper eyewear. But maybe think bigger too.
Yeah, here's something to consider. Given the high fall rate among older players, shouldn't we be thinking beyond just eye protection? Should clubs and courts maybe have signage recommending specific court shoes, or even advising on balance exercises before people play?
Taking prevention beyond just the eyes.
Exactly. If the national bodies won't mandate eyewear yet, what can be done at the local level to make the whole playing environment safer, addressing both impact and fall risks? It's a conversation that needs to happen. Protect your eyes, work on your balance, and play safe out there.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.